Okay, hello everyone. We are Can You Hack It? We are presenting our hacking equity. So the members of our group are Lena Anglin, Eddie Lopez, Zet Wang, Elisha Aziz, and Jonathan Banks. Okay, so the question that we decided to examine was, how were marginalized communities affected by the COVID-19 pandemic within the prison system and the Payment Protection Program, the PPP?
Yeah, so I guess I'll start this off with some of the visualizations that we made. So as we kind of discussed in the interim review, we wanted to look at case rates and death rates, not only amongst the prison population, but then maybe compare it a little bit to the outside, so like, I guess the whole country. And then also see if we can somehow match that up with, I guess, more of a racial or ethnic component to it. So this first result you see here is kind of the positive case rate amongst inmates. As you can see, it skews a little bit more northwest. And something that was very interesting, at least for us, is when you compare that between the case rate and the death rate. So if you go next slide real quick, it completely shifts down. So I thought that was something that was really interesting, was that even though per se your case rate was a lot higher, more northwest, I guess, localized, your death rate definitely came down to more kind of southeast. Something else that was kind of really interesting that we did, if you can go next slide, we mapped it up with the non-white alone population, or at least that's kind of how we termed it, which basically means that it's for anyone that's not explicitly white, so you can be white and Hispanic. So we pulled some census data kind of as our external data to look at maybe how more ethnic would line up with this, because ethnic data wasn't available in the New York Times data. And one of the things that we thought was very interesting was how it seems like they match up very well. So if you can compare the last slide to the first slide. Yeah, so to answer your question, Christina, I see you in the chat. Yeah, so case rate was mapped versus it was the number of cases over the total population. That's how we did case rate. Death rate, yeah, was the people that tested positive, or sorry, it's death rate, the number of deaths over the case rate. That's how that was kind of figured out. And yeah, so as you can see, they match pretty well between, like, we thought it was interesting how the ethnicity with the, I guess, the populations that were more, I guess, racially diverse seemed to be had a higher percentage of deaths, and it kind of matched up very well with the death rate. So that was something that was interesting. To give it a little bit of a context, we also just wanted to look like, what does that look like on the state level as well with the death rates? Did it just happen to match up with the non-white alone population? So just to give it a little bit more context, you go to the next slide. That's something we also did. And so it's a little bit different. I don't think the similarities are quite the same as when we kind of looked at the death rate in prisons in the non-white alone population. I mean, there's obviously some overlap just because we are pulling it from that same general US population. But I think it more closely matches, at least our visual does, with the death rate and the non-white alone population. So yeah, why there might be that skew, maybe because of underreporting, like where we get that difference between the total population's death rate versus the prison data. And Aline is going to talk a little bit more about that. Nina?
My apologies. So we came to 3 conclusions that influenced our policy recommendations. The first one being that coronavirus infections were significantly higher in prisons. In fact, in 2020, the case rate for COVID infections in prisons was 5.5 times higher than that of the US population. Our second conclusion is that social distancing is really an impossibility in prisons. A study done by Harvard researchers showed that every increase of 10 percentage points raised the risk of COVID infections by 14%, which is astronomical. And then finally, prison data is notoriously opaque. Even prior to the pandemic, prisons underreported several things, and the pandemic certainly didn't help matters. In fact, many states underreported their COVID numbers, and they rarely track their cases by race or ethnicity. And as you saw in our data visuals, the discrepancies between the total COVID-19 positive rates among inmates and the total COVID-19 death rates, especially in our southern regions, indicate a lack of COVID-19 testing in prisons. This was apparent in the case of Billy Bingham, who was an inmate at Albermy Correctional Institute in North Carolina, who passed away from COVID complications last year. His family was told that he did not have COVID, but an autopsy report indicated otherwise. And the case of Mr. Bingham is one of many testimonies that we came across in our research of prisons not testing inmates as they should have. So because of this research, we strongly recommend prisons, federal or otherwise, approve more compassionate release requests. And next slide. Just to kind of paint a picture of just how many people who are incarcerated were affected by the pandemic. As of today, November 17, 2021, there have been 436,983 COVID-19 cases among people incarcerated, 2,660 deaths of incarcerated individuals in prisons because of COVID-19, 119,553 COVID-19 cases among prison staff, and 239 deaths of staff working in prisons due to COVID. And so the next part of our presentation.
Yeah, so hello everyone. So I will be presenting our second piece of our work, which is were PPP loans dispersed more actively under Biden administration's reform. Next slide. So a little bit of background here. So Paycheck Protection Program, PPP, was the largest program providing funds to small businesses to counter negative impact of COVID-19 pandemic. First two rounds of PPP loans, they released $650 billion in 2020, and then another third round in 2021 released $227 billion. However, there were critics on the first two rounds, which are minority-owned small businesses were really less likely to receive PPP loans, and that they were really at the end of the line in the program to receive funds. So many minority owners desperate for a relief loan didn't really receive one until the PPP's last few weeks, while many more white business owners were able to get loans earlier in the program. So in order to further targeting PPP to the smallest businesses and those that have been left behind in previous relief efforts, the Biden administration announced a reform to the PPP program, which included in early February this year, which included a 14-day exclusive PPP loan application period for businesses and nonprofits less than 20 employees, and also include other additional changes to PPP. For example, eliminating PPP access restrictions, such as non-fraud felony convictions and student loan debt delinquency. So I guess the different thing about this piece of work is that we already have the intervention, and we want to evaluate how, is there any change brought by the intervention? Now, next slide, please. So did small business in minority communities receive more PPP loans post-reform? So we have all data, all PPP. So the data that we brought in included all PPP loans data, and then also number of business establishment and number of employees data, and as well as the census data that we already presented before. So our key outcome variable is we construct this number of PPP loans per business establishment at county level, because we want to compare number of loans received across county level. So we have to like normalize the number of loans. So that this is how we normalize or standardize. And actually we take that number and we took the difference in that
so
indicator.
We need to, you're at time. So can you go to just,
so we can
what's
go
your
to
wrap up? What's your punchline?
So next slides. So we can see the more negative, more positive change happened in the southeast area, which happens to match the pattern of non-white only population. And then next slides, last slide. So here's the punchline is like counties with higher non-white only population witnesses more number of loans after reform. So on x-axis, we have share of non-white only population, and y-axis is the difference or the change in number of loans. So our conclusion was that actually after the reform, there were more loans distributed towards minority communities.